I'm Dr. Sylvia Ziegenbein. I'm an OB-GYN, which is obstetrician gynecologist. I did my residency here at Nebraska Medical Center, and my medical school was here also. So I have a MD. I also have a master's in molecular biology that I got before I went to medical school. I tend to see a lot of patients with vaginal problems, vaginal infections, recurrent yeast infections, even away from the typical OB or GYN patients with abnormal bleeding, sexual dysfunction. Basically, they'll get a full physical and we'll do the pap smear, make sure there aren't any issues we can help them with. But we cover contraception, make sure they're not having any incontinence that's bothering them, breast exam. I mean, they just get a full history and physical. If there are other physicians that we need help, involvement with, we can provide that very quickly and with good direct conversation with that physician because they're in the office right next to us. The connection that I need to make is I need to see what kind of person it is that's coming in to see me. So I like to ask what they do for their hobbies, do they get much exercise, what's their job, you know, if they're married. So get a sense of who they are and what their daily life is like. And then I can figure out risk factors for them as far as obesity or they're not exercising enough. So the relationships come, that just comes. But for me as a physician, I need to know what the patient's doing on the other side. What are they doing when they leave the office? How are they living their life? I think it's important for them to be comfortable with their physician so that they can come to you with any problems. You know, we deal with very private issues, and if they're not comfortable talking about it, you're not going to give them complete care. So it's important.